There is a fly called berne that leaves its eggs in a mosquito. The mosquito puts the eggs on a person who does not notice anything. But over time, the larvae hatch from the eggs and get into the victim's skin, eating the person's flesh from the inside out. Besides this disgusting situation, many strange things can be found inside people, and that's exactly what you're going to see in this video. After suffering a car accident, Ma Van Not, a 54-year-old Vietnamese man, went through a serious and surprising situation that only came to light many years later. In 1998, he was operated on at BAC Can General Hospital, but without realizing it, 2 surgical instruments, 2 scissors about 15 centimeters long, were left inside his body. Ma Van Not only discovered this mistake 18 years later, when he sought medical help because of severe stomach pain that would not go away with medication. Even though he felt pain, the doctors could not identify the cause of the problem until he got into another car accident. It was after this second accident that tests revealed something sharp near his colon. A second exam confirmed that the scissors had been in his body since the surgery performed years before. Then, in January of 2017, Ma Van Not underwent a new surgery to remove the scissors. The procedure lasted 3 hours, and the doctors noticed that the instruments were rusty and stuck to nearby organs. The case drew the attention of the authorities, who demanded explanations from BAC Can General Hospital about who was responsible for the error. The hospital, acknowledging the difficulty in keeping such old records, promised to investigate. After the surgery, Ma Van Not recovered well. Not everyone knows it, but improper use of contact lenses can cause serious vision problems. Maureen Cronin, a 53-year-old woman from New York, lost sight in her right eye after contracting a rare parasite called acanthamoeba keratitis. The problem started when she began giving private swimming lessons to children. During the lessons, Maureen would enter the water wearing her contact lenses and often took off her swimming goggles to demonstrate techniques. Shortly after, the swimming instructor felt a discomfort in her right eye, as if there were sand or an eyelash stuck. As the days went by, the pain increased, and 2 weeks later, she went to a doctor who diagnosed a corneal lesion and prescribed eye drops. However, the treatment did not solve the problem, and the pain became unbearable. Maureen was constantly covering her eye, but the symptoms only got worse. After several medical consultations, a specialist identified the parasitic infection. She was admitted to the hospital and stayed there for weeks. Later, she underwent a corneal transplant, but the procedure failed because the microorganisms were still very active. The eye was severely damaged, leading to complete loss of vision. Since then, Maureen has developed a fear of water and even takes showers wearing swim goggles. This condition is rare, but most cases happen to people who use contact lenses incorrectly, such as swimming or bathing while wearing them. What seemed to be a simple ear discomfort turned out to be something quite unusual for a 64-year-old woman from Taiwan, who sought medical help after she started hearing strange sounds in her left ear. She spent 4 days struggling to sleep, hearing incessant pounding, clicks, and even the sound of something moving inside her ear. The feeling that something was crawling in there bothered her, but she did not feel any pain. To make matters worse, the spider had even shed its skin in there. Because it was so tiny, the patient did not feel pain, but the situation caught the attention of Dr. Tengchin Wang, who said he had never seen an insect shed its skin inside an ear canal. The spider was removed using a small suction cannula, as the insect was quite tiny. The procedure was successful, and once it was removed, the symptoms disappeared. Although it is a rare occurrence, experts say that cases like this can happen. Certain medical cases can surprise even the most experienced professionals. Maqsood Khan, a rickshaw driver from India, was admitted to Sanjay Gandhi Hospital after experiencing severe stomach pains. At first, doctors thought he only had a food infection, but tests showed something much more serious. Inside Maqsood's stomach, there were almost 6 kilograms of metal objects, including 263 coins, 100 nails, as well as razor blades, nuts, and chains. The surgery to remove all this happened in November of 2017 and lasted about 3 hours. His condition was delicate and he needed artificial respiration for a while, but he managed to recover. The doctors said that there were still a few coins left in his intestine, which would come out naturally. Maqsood's family already suspected that he had been swallowing unusual things. The doctors explained that this behavior could be connected to a mental disorder, possibly linked to depression. He was referred for psychiatric follow-up after the surgery. Having a larva growing under your skin might seem like something out of a horror movie, but it is a real problem caused by the berne fly. This fly does not lay its eggs directly on a person's skin. It gives the eggs to a mosquito, which, when biting someone, places the eggs on the skin without the person noticing. Those eggs turn into larvae, which enter the skin and start eating the flesh from the inside, causing pain and making the skin swell. The larva creates a small hole to breathe and feed, making the area very sensitive. This problem is more common in rural areas, especially in regions with plenty of cattle and animals, where the mosquito can easily go from an animal to a human. The infection starts with the mosquito bite, but the larva keeps growing under the skin. When the larva is in the skin, treatment is necessary to avoid further damage. Treatment begins with injecting fluid into the swelling, usually a saline solution, which helps loosen the larva and reduce pressure and pain. This fluid makes it easier to remove the larva, making it simpler to pull it out from under the skin. After injecting the fluid, the larva is removed with tweezers. It can be uncomfortable, but it is important to prevent the parasite from continuing to feed and causing more inflammation. After removing the larva, the area must be treated with antibiotics to prevent infections and painkillers to relieve pain. With proper treatment, a person can recover well, and the affected area heals without complications. Berne is more common in Latin America, especially in Brazil, Argentina, Paraguay, Bolivia, and Colombia. It can also occur in Central America, such as Mexico and Costa Rica. Rare cases happen in the United States and Canada, usually in travelers. A rare and terrifying condition was discovered in a patient in Florida who, after experiencing unusual symptoms, underwent a surprising medical procedure. In February of 2024, a man who had survived cancer went through a very unusual procedure at a hospital in Florida. After noticing a swollen face and constant nosebleeds, he sought help at the HCA Florida Memorial Hospital in Jacksonville. During the exam, the doctor noticed something strange and, upon using a camera for a better look, found 150 live larvae inside the patient's nose and sinuses. The doctor in charge, Dr. David Carlson, explained that the parasites were feeding on the internal tissues, which caused inflammation and worrisome damage. Some larvae were only moving around the area, while others had already penetrated the tissues. The doctor tried to remove them with suction, but the equipment got clogged because of the size of the parasites, forcing him to remove them manually, one by one. Experts believe the patient developed a condition known as nasal myosis, which happens when insect larvae settle in wounds or body cavities. He believes the problem may have started after handling dead fish without properly washing his hands. The treatment included removing the larvae and a special rinse with anti-parasitic medications. In July of 2011, a farm worker named Leonardo Santana, 46 years old, who lives in Rio Piria on Marajo Island in Brazil, went through a very serious situation. Alone at home, he inserted a beer bottle into his body. The bottle was filled with water, but when he tried to remove it, he realized that the object had already reached his stomach and would not come back out. He mentioned that he was in the habit of putting the water-filled bottle inside his body, but this time, it did not come back. Moreover, Leonardo explained that he did it secretly, without his wife knowing anything about it. When the situation became public, he faced difficulties, including embarrassment in front of his wife, who did not accept what he had done. To solve the problem, the man had to be treated at the hospital in Curalinho, where he underwent an emergency surgery. The operation was quite delicate and had to be done with improvised instruments, since the local hospital did not have the proper equipment for such a procedure. The medical team made an abdominal incision to remove the bottle. Despite the challenges, the surgery was successful, and the patient recovered without major complications. In an unusual case, Mark Johnstone began experiencing a persistent pain in his groin, which suddenly turned into a sharp, intense pain. He felt as if something had been torn in his genital region. Mark tried to ignore the pain, thinking it might just be cramps, but the situation got worse. When he looked at himself in the mirror, he noticed swelling and a small opening in the skin, from which a liquid emerged. At first, he thought it was just an infected mosquito bite, but the pain did not go away. Worried, Brenda, his wife, insisted that Mark see a doctor. He was reluctant, but finally went, and the doctor diagnosed an infection caused by an ingrown hair. Although it sounded plausible, Mark was not convinced that this explained the intense pain. He began to feel something moving inside his body, in the affected area. After this discovery, he urgently consulted a urologist, who quickly realized something was off. After some tests, the doctor found something shocking. Fly larvae had taken up residence in Mark's intimate area. These larvae were feeding on the tissue and causing extreme pain. The doctor removed them in a surgical procedure. Mark was stunned to learn that larvae were behind his pain, and the treatment finally gave him relief. Situations involving animals or insects stuck to the skin can be frightening. That is what happened with a teenage girl who needed urgent help when she realized what was on the back of her neck. When she put her hand there to feel what was wrong in the back of her head, she found several tiny little balls clinging to her skin, looking like insects. The girl was extremely scared, as she stated in the caption of the video posted on YouTube. She asked for help to get rid of the creatures. That is when she found out that those little balls were black and nasty with an oily texture. Unfortunately, the insect species has not yet been identified. Medical errors can have extremely serious consequences, as in the case of 22-year-old Melina Rodriguez, who went through a very serious situation in the hospital after her twins were born at the Children's Hospital in the state of Espírito Santo in Brazil. Although the babies were born healthy, Melina faced postpartum complications, including hemorrhages, and had to remain hospitalized for several more days. Her condition worsened with a high fever of 40 degrees, and she had to return to the hospital. That was when an ultrasound examination revealed something frightening. A surgical instrument had been left inside her uterus during the cesarean. It perforated her liver and part of her intestine and caused her to lose her uterus. The medical error and the delay in diagnosis prolonged Melina's suffering. The surgery to remove the instrument took place long after the diagnosis, causing even more anguish. After the operation, Melina urgently needed an ICU bed. Her mother, desperate, sought help from the public defender's office to ensure her daughter received the necessary care. To make matters worse, Melina was fired from her job while she was still recovering from the surgery. Unexpected problems can happen even in simple procedures. That is what happened to a 72-year-old British man who, after surgery to remove an abdominal lump in August of 2019, ended up facing complications. During the operation, his dentures got stuck in his throat, and he did not realize it at first. He initially thought his dentures had simply been lost in the hospital. 6 days after the surgery, the man returned to the hospital complaining of blood in his mouth and difficulty breathing and swallowing. The doctors diagnosed a respiratory tract infection and sent him home with antibiotics and other medications. However, 2 days later the situation worsened, and he went back to the hospital. That was when, upon examining his throat, the doctors discovered the dentures obstructing his vocal cords. He underwent emergency surgery to remove the dentures and stayed in the hospital for another 6 days. Despite the complications, he fully recovered after some time. Accidents with small but dangerous objects have become more and more common, especially among children. In March of 2012, 3-year-old Peyton Bushnell went through a very serious situation after swallowing 37 high-powered magnets. The child started complaining of stomach pain, but her parents, Aaron and Kelly Bushnell, initially thought it was just a typical tummy ache. However, the symptoms persisted, and when they took her to the hospital, an X-ray revealed a circular group of magnets in her stomach. The doctors explained that the magnets had pulled her intestines together, causing serious damage by perforating part of her stomach and 3 parts of her intestines. The main theory is that she mistook the small magnets for decorative sprinkles she used to see on cupcakes. Peyton was quickly taken to surgery at the Children's Hospital of Portland, and fortunately, she made a full recovery afterwards. Swallowing objects can be dangerous, but the case of Anil Barela was even more rare and frightening. The 12-year-old boy was playing with his friends in May of 2012 when, during a game with live fish, he ended up swallowing a 9-centimeter fish. However, instead of going down his digestive tract, the fish ended up in Anil's left lung. Things got serious when the boy started having trouble breathing, and he was rushed to the hospital. X-rays showed that the fish was in his lung, making it difficult for him to breathe. The boy's oxygen level was well below normal, indicating the severity of the problem. Acting quickly, the doctors performed a 45-minute surgery to remove the fish from Anil's lung. Fortunately, the procedure was successful, and the boy recovered without any complications. Don't forget to subscribe so you can watch more videos like this.